Welcome to the Beauty Outlaw Podcast. I'm your host, Jerry Hurst, a registered nurse and licensed esthetician with over 30 years of experience in the world of aesthetics. I live and work in sunny Orange County, California, where I own a clinic and spa focused on expert-level care, where this podcast is filmed from. And we bring to you all things beauty and health, and I'm so glad that you're here with us. When I'm not working with patients, I love coaching and training other professionals. So whether you're a registered nurse, a physician, or a physician's assistant, looking to level up your skills, I offer certifications in neuromodulators like Botox and Dysport, as well as microneedling. And for you licensed estheticians out there, I've got a specialized course in dermaplaning and chemical peels, which, by the way, nurses love too. But here's something really exciting. If you want a full hands-on experience, I offer something called a shadow day. It's an entire day by my side, giving you a real look at the industry, both technically and the business side. It's a perfect way to immerse yourself in the med spa world. If that sounds like something you'd like to do, check out the show notes for the details. You can also hop over to Instagram and send me a DM and someone will reach out and get you scheduled. The booking link is live though for Shadow Days, so you can go to the link in the show notes and I hope to see you soon. Thanks for joining me today. Can't wait to share more of my world with you. Today, I've got something big for you. Whether you're an aesthetic provider or a patient, we're diving into facial ultrasound and facial mapping. These are two revolutionary tools that are setting new standards in safety and precision in the world of aesthetics. If you're a provider, you'll discover how these techniques can elevate your practice and protect your clients. And for patients, this is your chance to learn what goes on behind the scenes to ensure that every treatment is safe, accurate, and tailored just for you. Don't miss out. This conversation could transform and will transform your approach to beauty. That said, I am thrilled to welcome back my special guest, Janell Ocampo, a highly accomplished aesthetic injector, aesthetic entrepreneur, family nurse practitioner with a doctorate in nursing. Janell brings a wealth of experience to the conversation today. She owned multiple aesthetic spas and is a top-tier trainer for Galderma, as well as on their faculty. What really sets her apart is her background. Before becoming a nurse practitioner, Janell was a sonographer, which gives her extensive knowledge in ultrasounds. She also has a YouTube channel where she shares short, insightful videos using ultrasound in aesthetics. I encourage you to check out her previous appearance on this podcast. Janell shares more about her journey into nursing and how she grew a successful business and became an aesthetic millionaire. Now, I would like to welcome back to the show this amazing human who I call a friend, Janell Ocampo. Okay, everybody, she's back. It's Janell. I just did your wonderful intro, Janell, and I'm so happy that you're here today. And today, I've explained to the viewers we're talking everything ultrasound, and my go-to person for that is you. And I explained why. Janell, do you use ultrasound now?
I do, yes.
In your practice?
Yes, yeah. Thank you for having me, by the way.
You're welcome.
Really excited to be here. Yeah. And spread more awareness about ultrasound and aesthetics and how it can improve safety. So I'm just ecstatic.
I know.
Yeah.
Now, if I remember from the first time we chatted on the podcast, when you did your doctorate of nursing, I think you might have done it at Complications, Aesthetic Complications. Am I wrong or right?
You're right.
Okay.
Yeah. So injectable related complications is what I did my doctoral project on. And so it's been a personal passion of mine for so many years because aesthetic medicine isn't as regulated as it should be, in my opinion. And we get a lot of training from pharmaceutical companies on how to inject, but managing complications isn't as big of a focus in aesthetics because these pharmaceutical companies have FDA approval on the products, not necessarily on reversal agents or managing complications. And so it isn't as big of a focus as it should have been all these years. We're seeing more awareness, which is exciting.
We are. And especially with ultrasound coming in the forefront there's some leaders in that. I think one of them is Dr. Stella. She is in Seattle.
Yes.
She's been one of the, I want to say, grandmothers of ultrasound. She'll hate me for saying that. But there's her, and there's, of course, Dr. Stephen Weiner, who's a proponent in training ultrasound. I think he has an academy where he trains providers on ultrasound. One of my first things I'd like you to do is, as a provider, I think you become a little frightened to jump into the ultrasound world because there is a learning curve.
There is.
It's kind of like when we first got that iPhone and we just couldn't figure out how to use it, but the more we used it, the better we got. And it has been a game changer for me in my practice. It's really made me feel more confident and secure, and also giving that extra protection to my patient. Now, can you explain to us and the providers that are listening right now a little bit about the basic science of ultrasound and what it is?
Yeah. Ultrasound uses sound waves to penetrate the tissue, and those sound waves come back to a transducer, giving us an image. So depending on the density of its object of interest, whatever we're pointing that transducer at, depending on that density is how we'll read the image. So if it's something that's very dense, like bone, we'll read that image differently than we would read soft tissue. And so that's what ultrasound is. And, I can go into details, but we have
try
different...
to keep it basic.
Yeah, okay.
Because I think that's where people become a little afraid when we start using the terminology of hypoechoic and the echogenicity of something, that people think, oh gosh, I don't know if I can do this. But those are just, or the gain, those types of things, those frightened me. And the more you jump in, you realize, oh, that's the easy part.
Yes.
It's learning to read the gray and the dark gray.
Yeah.
And the white. But is there any advice that you can give to someone that's getting ready to take a course, what they should hope to come out of it by the end of that day? They're not going to be a pro.
Right.
Then.
Yes. I think it's whatever content is covered in that course, take that, review it again, and practice. Everything that you've learned hands-on, it's so important to practice coming out of the class, because it's similar to injecting. If you go to a class and you're trained to inject, but you don't have a job in aesthetics yet, and then you get a job a year later, well, basically everything you learn in that one class is probably gone, right? Yes. But if you have a job in aesthetics and you have an opportunity to practice what you just learned, then you can put it to use. And same thing with ultrasound. Ultrasound does have a learning curve. My ultrasound course it had 2,000 clinical hours. That's a lot, right? Yeah. But I learned many exams. So facial ultrasound is one specific exam that can be learned, and which is why a lot of sonographers or radiologists don't know facial ultrasound, because they haven't learned that specific exam, because it's not in enough demand yet in the hospital or outpatient centers. And I think that'll eventually change, but as of right now, you can't just simply order an exam. So it's up to us practitioners to learn that exam ourselves and put that into practice so we can improve patient safety.
So when you're looking at ultrasound equipment or purchasing for facial, we'll talk about facial aesthetics. I know there's sound waves you mentioned, so frequencies. Right. And the facial mapping, which is looking at vessels, but facial mapping or facial ultrasound uses frequencies differently than, say, when you go get your baby looked at. That's a lower frequency, am I right? And then there's high and there's lower frequencies.
Yes. So an example for an abdominal ultrasound, that's probably going to be somewhere around 5 megahertz. That's the frequency, which is a bigger wavelength. So the bigger the wavelength, the deeper the sound waves will penetrate. So we can get further into the abdomen. If we want all of our focus in a very shallow amount of tissue, then we want a high frequency transducer. And so that usually for the face will need to be somewhere around 12 to 20 megahertz or even higher, depending on how much resolution you want, very superficially. So that's how we focus on different levels of tissue. Does that make sense?
Yes, it does. Okay. That makes really good sense. And it's also about the software as well. I mean, software, resolution, all that matters when you're visualizing as a provider. I know with me, the visualization is really important for me because I'm newer at this. And I have to have, I feel like my resolution has to be really on for me to be able to identify the right structures.
Well, aside from frequency, so you get better resolution depending on your depth of focus, so that frequency is extremely important. But in terms of software or quality of equipment, there are differences. And, big hospital units that might be a couple 100,000 easy, if not more, are going to have better software and better resolution of the exact same frequency transducer than what we could get out of a handheld, right?
Right.
And so they're going to be able to read that image a lot easier than one of the lower price units, but it's going to be based on that clinic, what they're willing to invest into a device and what they're willing to practice on a regular basis to know how to use the device, to know how to adjust the software so it's working best for them.
I know the software I use, which is I like Clarius. They've really stepped up the game, I feel like, for people that are learning ultrasound. They've made their settings embedded in the software. And I like that because it makes me feel more confident in what I'm seeing and reading. Another question I meant to ask when we were talking about frequency, and so I'm going back, but this is for patients.
Okay.
Is it safe for them? Patients do have that question. Is it safe for me to have an ultrasound on my face?
So ultrasound has been around for well over 50 years. I don't know the exact number, but well over 50 years. And it's shown to be safe. So there are no known side effects when it comes to diagnostic ultrasound or non-diagnostic ultrasound in terms of just trying to grab an image.
So like something like therapy, that's a higher frequency.
We're talking about
that can be more dangerous.
Yeah, so
more risk related.
So we're talking about a different type of wavelength and technology that I'm actually less familiar with in terms of safety profile. I know there are other risks in different types of ultrasound devices, but diagnostic ultrasound transducers to get images, those are very safe. Yeah, no known side effects, which is why we potentially scan women even on a weekly basis until birth.
Yeah.
And babies do just fine.
I'm glad you clarified that because that is something I've seen on blogs with patients. Okay. They're like, well, you can't just ultrasound your face, but you can for diagnostic purposes within certain frequencies. And I assume, like you said, other products or other frequencies that are higher have a different safety profile, but diagnostic ultrasound is very safe.
Yes.
Okay. Yes. I'm glad we stated that because I get that question and I read that question a lot, and people shouldn't be afraid of diagnostic ultrasound.
Yes. And I also want to further clarify, when we talk about diagnostic ultrasound in traditional medicine, usually that diagnosis is read by a radiologist and not a sonographer. And that we have a limitation to. And so there could be cases where a patient is told this is non-diagnostic because it's not being read by a radiologist. And the reason is because we have limitations in current medicine right now, and most radiologists cannot read facial ultrasound. So the sonographer or the provider that is providing the service at that time can do their best to have a very centered point of interest and try to figure out what the situation is, but they're often not going to have a true diagnosis in terms of that diagnostic ultrasound. So I just want to make that clarification.
Yeah, that's a good
And sometimes in
clarification.
consents, it'll say it's non-diagnostic because the radiologist
We're not going to, the radiologist
isn't going to be reading the image.
Yes. We're using it as a guide, a helpful guide for our aesthetic procedures.
That's right.
Do you see this as being put into the standard of care in aesthetics? Do you think this is going to be a standard of care thing for ultrasound? In other words, it's going to be something in order to perform injectables you will need to perform prior to injecting, like a facial mapping of ultrasound?
I am not sure. I think that ultrasound is a very helpful tool, and it's going to be more and more widely used over time. Whether that tool is something foundational for every provider or not, I don't know if we're going to get to that, but I can tell you that any patient that's receiving ultrasound as part of their injectable treatments, whether it's to treat or reverse, they are in great hands, and their outcomes are probably by far superior to someone blindly injecting, right? And it's not that a provider can't do an amazing job at providing a treatment without ultrasound. It's they can do it even more precisely with the most precision by using this tool, ultrasound, during their practice.
They're just knowing that you have a way to verify is what I love, especially in the temple region. That's a place where I know I have a lot of colleagues that are really utilizing ultrasound now, mapping the vessels prior, or they're doing it ultrasound-guided, which is quite a task in itself to do. That is, to me, that's a skill that just takes practice and practice and practice. Do you do any of that, Janell, at all? Any kind of guiding?
Yes,
ultrasound guiding?
I do. And I don't do it every time I inject, but I do ultrasound guidance during some of my injections. And I think either doing ultrasound right before or during an injectable treatment can definitely improve the safety and the outcome when it comes to injecting the temple. I have seen cases where there's a foramen deep in the temple and there's an artery right there. And it's not like the norm, but it sure is nice to identify that and then, not blindly inject into that area, right?
Yes.
And so that's not something I see all the time, but on the occasion that I see that, I'm glad I scan the patient first.
Yes, I love.
Same with the piriform,
The piriform.
and the angular artery right there on the bone, or finding another vessel in that area as well, which is another possibility.
The piriform has really been a place where ultrasound really has. It's almost like taking, in a way, and I don't want to say this, but in a way, it's kind of a little cadaver course. You get to look at the layers of the skin, although it looks a little differently through ultrasound, but you can see vessels which are supposed to be in one plane and they're not there. And 30% of the people, it'll be in the wrong space. And you can identify that.
Like, what? There's all these branches and there's this accessory artery and all these things that the books didn't necessarily tell us.
Well, when you inject the piriform, you go to the bone.
Right.
And some people, that's a risky place, especially that's where their vessel lies. So I think that's where ultrasound has really made me feel more confident and safe, is just doing that little scan, take a quick peek. It makes you feel way more comfortable about injecting there.
I agree. And another thing, especially for people that are new to scanning, there is some talk out there about check for an artery, and if you don't see it, then you can inject. I think looking for the artery and making sure you find it first is a great idea, especially for a newer someone that's newer to scanning.
Oh, scanning, yes.
Yes. And the reason is because if you're just off by a little bit and you don't look for the artery and then you go back in at a slightly different angle, you could still hit the artery, right? And so really looking for the artery and getting used to being able to identify where the artery is going to improve patient safety. Now, when you're super skilled and have been doing this for years, you might be able to just go in and quick scan and make sure there isn't a major artery in that area without having to identify where the artery actually is. But I think it's a good idea to take the time to actually find the artery and not just assume that it's not there because you didn't see it when you pressed and let go.
Yes. That's really good advice. It's so true. You got to take the time.
It does take time.
It takes time. Yeah. And that's, I know where a lot of our colleagues, people in the industry, are off put by learning this skill because it will add time to your treatment when you're learning. And I've just made it a point of, I almost pull it out on everyone, just for, even if I'm doing a little Botox in the depressor here, I'll just do it. The patients love it. It gets my skills better, especially my dexterity with holding. And you have the this is ultrasound, guys. This is what a machine looks like. There's multiple machines, but this is a really lovely little device. But you're holding this and you have ultrasound gel on, and you're not used to doing that. And you're looking over here, and next thing you know, you're on their neck. And you're supposed to be here because you haven't learned the dexterity of the pressure, the amount of pressure, the weight of the unit, and looking away. So just those little things are little skills that I've learned can be, your procedures can be affected by. So you really need to practice, practice, practice.
Yeah. And I think that that's a great area to talk about is the DAO and the DLI. It's so common to accidentally hit the DLI because of using the wrong either depth of penetration or going too medial. But you can get more medial or also pick the right depth of penetration if you're using ultrasound, right? And so you're less likely to hit the DLI and create that dreaded
crooked smile
droop, right? From the side that you didn't hit the DLI. And then you don't have to worry about that outcome, right? Is because you use ultrasound guidance to inject that.
It's really a great way
DAO.
to start, I think, when you're doing ultrasound and if you're doing neuromodulators, is that area, the lower face.
Right. I have noticed, though, that the bigger plug-in units, you can see this area so much easier
than you can
the rechargeable ones. So it's also a bigger learning curve, even though the software is great because there's all these presets that you can use for different depths, right? In like the Clarius HD3 L20 software. But some of the bigger units, you can see the image so much better. It's easier to scan on one of those. It's a bigger initial investment.
That's where I think it's great. I may not have progressed up as I will, as I get used to this, progress up to those better units to make my life easier and be able to identify and see things, like you said, better. But this initial investment is great to get started, to practice, to do these little, get your dexterity down, your hand-eye coordination, because there is something to ultrasound when it comes to that.
Definitely. And if you got this, then it gets easier after that if you get a better device, because the image quality is better, and then you can see things easier. And then it doesn't die on you if you're trying to manage a complication. It's plugged in, and so it's like good to go.
And then you have to
connect
the fan.
Or connect the fan. Yeah. Depending on the device, the Clarius has a fan to keep it from overheating.
Yes, keep it from overheating, especially if you're using it for long periods of time.
Yes.
So you can start baby steps like I have and progress up. I really encourage people to bring this into their practice. I think it's an amazing modality. I think you will be left behind if you don't do it. Patients will seek it out. for that safety measure. Let me go to some of my little notes because I wanted to hit so many points with you today.
Sure.
Let's see here. We did talk about safety. And have you ever, Janell, been part of fixing a severe complication?
Yeah, I actually get called a lot because there's a number of people in the local community that knows I do ultrasound. And so when there are vascular occlusions that are resistant to blind reversing with Hylenex, I've been called a number of times to help with those cases. And most of them, I've found that it's pretty easy to see where the occlusion is. And so we can go in and inject a smaller amount than we would have used otherwise with the hyaluronidase or Hylenex, which is what we use here locally. And so that's been really helpful. I have seen a case where it wasn't as obvious and I was limited on time. And so that was tough. But I've had a number, I think, around 7 other cases where it was just so obvious. I put the transducer down, was able to find where the occlusion was and be able to, have the Hylenex injected right there. And so that was really helpful. Yeah.
Hi, everybody. This episode is sponsored by Pretty Girl Cosmeceuticals. These products are the best. If you're not using them, you need to use them. You can contact JKH Aesthetics anytime, and we will give you a consultation about how to use these amazing products. We have Glow Girl and Ice Drops. These will keep you young, healthy, and glowing every day of the week. And now, back to the episode. The risk of blindness is something that's real, although it's, what is it about, they say 1 in 500,000, something like that, 1 in 100,000. I heard that a couple years ago. It might be 1 in 5,000 now. I know 500,000 people injected. And that's definitely from the glabella area, they say, and the piriform, right? Have you been a part of any of these unfortunate complications?
No, not blindness. Okay. But my understanding is that blindness has occurred from injecting all areas of the face.
Okay.
But the highest risk of blindness is the glabella and the nose.
Okay.
Yes. Okay. But I believe it's happened in
other cases.
In all other areas of the face. It's just extremely rare.
Very rare.
Yeah.
So ultrasound can really make that safe, especially for those injection areas. In the right
preventatively,
hands.
Right?
Preventatively. But you can see, do you inject when you, like you said, you did the temples, you do the temples. Do you check afterwards too to make sure your placement's right? No vessels were occluded. Do you do that every time you do temples or no?
Not necessarily, no. Okay. If I'm quite confident where I'm injecting, I don't go in and check again. But I have a number of times, which has also helped teach me that where I'm putting the filler is not necessarily where it's going. And so it's taught me to be a better practitioner and a better injector. And I understand that backtracking better. I'm more mindful of it, of the product following that path of least resistance, whether you're in between muscles or on bone, you're under a muscle, in a muscle, or superficial, or you're using a cannula and it follows the cannula back up, right? So the product isn't always being placed where we believe it's to be it is placed. And yes, it can migrate even after, but I find a lot of the product is actually not sitting where you think it's sitting in the first place when it was first injected. And that's what's so helpful about having ultrasound on hand, is to be able to identify that as well. I think even doing ultrasound, similar to taking multiple cadaver classes, you end up learning and understanding anatomy so well that it's like it's another language for you that you can speak really well, versus having to look up in a book where these different landmarks are. You know it because you saw it so many times on ultrasound. And it's the same thing with body.
Is really what you learn with this.
Absolutely.
Yes.
And
yes.
that's what I learned when I was working as an ultrasound tech in a major hospital, is I understood anatomy inside and out really, really well. And the same thing, I mean, I already knew anatomy of the face, but when I learned ultrasound for the face, my in-depth knowledge of anatomy became so much better. Yes, it soared. It was so much better. And so I think there's a lot more to learn or to be had by learning ultrasound. There's so much that gives a practitioner. They become better injectors, even if they're not actively scanning in that moment. They're more mindful of what they're doing because they've seen it under ultrasound so many times.
What about dissolving filler? Are you doing much of that? You know, that originally that was quite the rage, just to go in and dissolve your filler. But there's also people that need it dissolved, pockets of it. Do you do much of that?
Yeah, it can be really helpful. And it might already be obvious where the patient needs dissolving. And depending on how integrated it is, it can be less obvious where filler is. But it's also very obvious where pockets of filler are, and that can be really helpful in terms of trying to dissolve filler. We've seen patients 3-4 dissolving sessions, and we put down the ultrasound and we find multiple pockets. It's just the Hylenex didn't penetrate those areas, whether we weren't in the right depth or it's encapsulated. So no matter how much Hylenex you inject, if that filler is encapsulated, if the body encapsulated the filler, it will not penetrate. And there's talk about how Hylenex or hyaluronidase may not penetrate vessels very well, especially depending on how thick the lumen of the artery is, right? And so being able to identify your point of interest under ultrasound can be extremely helpful.
Yeah, it's great. It's just wonderful. Let me see here. Okay. Now, Janell, I said in my opening, Janell has a really wonderful YouTube channel that you've started just to try to get some these great short videos that give these little pearls for especially new people that get to watch, but even people that have been doing it a long time. What would you say to a provider? What should they do first when it comes to training and education? Do you think they should buy their piece of equipment? Should they take a course? And do you have recommendations?
Yeah. I've trained a number of providers so far, and so I'm very opinionated about this one. I'm actually opinionated about a lot of things.
I love that
in
about
life
you.
at this point. Let me tell you. But yeah.
She trains and educates.
Yeah. But for those that take a class without having an ultrasound, it can become very wasteful what they did because they're not practicing it right away, right? They have to go and order the ultrasound. It has to get there. Then they have to remember what they did, and they probably won't. And it takes work. It's like doing homework. Do you like to do homework? And if the device isn't there yet, probably not going to do your homework. Yeah. So my recommendation is to get an ultrasound unit first. Make a commitment, whatever level device you're going to get that device, and then take a class, right? And there's going to be some foundational information that might not feel as good to learn, like gain. But if you don't know how to adjust your gain and you don't even know what gain is, you're not going to be able to scan or depth of penetration and your focus and frequency and anechoic, hypoechoic, hyperechoic. You have to speak our language. If you want to do ultrasound, I'm going to teach you some basics of my language, and you need to practice it. You need to know it, or we're not going to be friends.
And these are things people can learn before they even go to a course, though, which are great. The terminology portion. There's all kinds of videos on that. I think you have a video.
Yes, I do.
Explaining that.
Some of those basic words.
And that's great because then you walk in the door and you feel somewhat, you know how to speak a different language in a little way.
At least if you're not hearing it for the first time, help with learning it.
Yeah.
Because it's not easy, right? These are words that we don't use in everyday practice. These are words that are commonly used in radiology, but if you don't have a radiology background, they're new words, right? But if you're going to document what you're doing, you need to do it appropriately.
Not I
you
found
could
a
say there's a black ball. It's yes. No, you can't do that.
No, you can't.
Right? Like if somebody pulls your case, you're
oh boy.
Yeah. And they read that,
Makes
they're
it to
gonna be like, what are you doing? And why were you holding that ultrasound? Right?
So true. Know your terminology.
Yeah, so you can document appropriately,
Yes.
even if you're not speaking the same language. Nope, they don't want to call me. They still need to know it to write it down. Yeah. And then just understanding, the frequency wavelength, so they can choose the appropriate one for their patient, and they understand why they're picking forehead versus cheeks, right? The depth of penetration and the difference in that, the area of focus and wavelength. Those things are helpful. So that foundational information is there for a reason. And that's why sonographers are big on it and we don't skip it. We try to cover it in a way that, it's learnable and you can swallow that little bit of information before we get into the hands-on component. And then that hands-on practicing is just so important, and to continue doing it after you finish the class.
Your dog, your husband.
Yes.
I bring it home and I mess with everybody. Do you have a recommendation for someone that's getting ready? They want to take a course. They're not sure if they really want to utilize it. Some people are like, am I really going to use it? What type of investment? Do you have a recommendation? I shared which one I started with.
Yes.
Do you have a recommendation for others that are maybe getting their feet wet?
Well, for somebody who's not sure, I think they should just still buy it. I mean, most aesthetic practices are making decent money. Just make the investment and get it, and then take the course. Otherwise, you're wasting your money. And so I don't recommend just taking a course without getting a device. In terms of devices, my recommendation would be a plug-in device. And I know that might not be within the budget of all practices. So the next best thing would be the Claris HD3 or the Vscan Air. And those are a couple, those are a couple of common rechargeable devices. Just keep in mind that if you have a vascular occlusion, it's probably not going to last. You're going to have to hold the patient there while it recharges and then scan them again, unless it was a quick reversal. And, a lot of them aren't. So there's a limitation there. And they are a little harder to read. But if you get good at this and then you decide you want to buy...
Which one do you have? Well, you have multiple ones, probably.
Yeah.
She probably has a museum of
right.
ultrasound machines, right?
Yeah.
Which one's your go-to right now?
Well, I don't have it yet, but I will be getting the Mindray TE5, which is a plug-in, and it's the most entry-level plug-in model out there, but not necessarily in terms of quality, because there are some that are up to twice the cost, and the quality is quite comparable. So I think that one has a pretty decent price point for most practices as well. But yeah, I've been on a bunch of the handhelds, and I have a few at home as well. But
yeah, like when you have to go on a call somewhere, somebody calls you and maybe they don't have one in their practice. What do? You grab one of your handhelds and run over there? Is that what you do?
Yes.
In your little ambulance?
Yeah. The Mindray is actually also portable.
Okay.
You can detach it, and it's portable as well. Yeah, or for travel and things like that.
So initially, someone can get set up, under $10,000, or you can spend up to, like you said,
there's
to $200,000.
You can spend infinite amount of money
on ultrasound. But like you said, aesthetic practitioners, you're doing just fine. This is something you need to invest in, especially if you're doing filler and injectables all day long in your practice. This should be something that you invest in and invest your team in. And you don't want to be the one person in the practice injectors that is the one everybody has to go to when they need help either. It's not fair to that person. They become overwhelmed.
Well, what I can say at this point is it's not in enough people's hands So being able to scan to improve patient safety and outcomes will set a provider apart at this point. But hopefully it'll become more of a standard of practice. I think it's just an amazing tool and a fair enough price point that it should be in every practice. So that is my recommendation.
There'll come a time when we look back and we go, can you believe we injected filler for 20 years without having access to ultrasound?
Right.
I mean, we were just, it's hard to believe that it really is filler is safer than we make it out to be, but it does have these risks to it. And if you can mitigate it or be able to get out of it with a utility like an ultrasound, I don't see why you wouldn't want to do it and be progressive and move forward with it.
And their patients would be so lucky to be in their hands, taking care of them. Yeah,
that's a question. What do we tell patients? If they wanted to call, should they be able to call, and should they call and find out if their provider has ultrasound prior to their appointment? Filler, do you think that should be something a patient should do?
It would improve safety. So we have had that happen, and it's rare, but there are situations where patients have become aware, or they had history of an adverse event, and so they only want to be injected under ultrasound guidance, or they have a complication like residual edema in an area where they have filler, and they know they need ultrasound because they were told, and so they're searching for a clinic that can assist them, right? And so there are clinics like that being sought out right now by patients. I think the demand's going to increase as awareness becomes even more heightened, like with podcasts like these.
Yeah. So patients should know that it's okay if they do that.
Yes.
They can call, and when they make their appointment, say, hey, do you guys have this modality in your office for me if I come to your practice? I think it will raise the awareness of this, and it will force people's hands.
How about this? If you were to come to me.
Yes.
And
just might be doing that.
And I said, I care so much about your safety and the outcome of this treatment today that I'm going to use ultrasound to lay down the filler. I want it to be so precise and it go exactly where I intend to inject, and you not have a single complication. Would you want to have a treatment outside of ultrasound after that?
Nope.
You wouldn't. You'd be like, I want to get it done by Janell. She said she cared so much about my safety that she did it under ultrasound guidance, and I didn't have any issues.
Yep.
Right? Like that would feel good.
That's what's going to happen.
That would feel good.
Mm-hmm. That would feel good. And it's important. And that's why people like you and including me have gotten in. Well, you've been in this a long time, but people like me, it's all about, because it's not about making the money when it comes to ultrasound. It's not about the investment, I think, is why people shy away, because they don't have a way to make their money back. But you are making money. It's
How about
safe.
retention?
Retention. Yes.
Patient retention.
Retention.
Let a patient go look for another practice like that. There are a few out there, but they're not a lot, right? Yeah. And so say the lines were busy one day and they got voicemail. And some patients, when they get a voicemail, they'll call the next practice, right? Or you're on vacation for 2 weeks and that patient really wants their filler that week. Well, if you did it under ultrasound guidance and they really appreciated the fact that they were so much safer, they're probably going to wait a lot more than the other patient that didn't have filler under ultrasound guidance, right?
Yep, exactly.
Yeah, that'll set a provider apart.
It will.
Yeah. And they'll have less complications. Their life will be easier. They can sleep better at night. Yes. Less occlusions.
It's just so wonderful. It sounds so wonderful. It is wonderful. Janell, tell us a little bit about your education. Do you have that put together yet? Are you just doing, I know you're super busy. Have you put together a training program? Do you have one? If people want to reach out to you, will you train? Where do you train? Tell us all things, please.
So up until now, I've only provided trainings via word of mouth. And
she's busy.
I went out and I am now CE certified. And so if somebody wants to take an ultrasound course with me, they get 8 CEUs for us to hang out together and do some cool stuff with ultrasound. I'm going to make sure that they're proficient before we leave before the end of the day. But so far, it's only been word of mouth. I will put together a website. And as you know, I sold my practice a year ago. And it was a very busy practice and was supposed to retire me. But I'm just addicted to the business and the industry and improving patient safety, especially in the local community here in Southern California. I have a passion for patient safety, and it's my personal mission to help empower other providers to improve patient safety as well. And I want to do that through ultrasound. So I'm here. I'll put together the website soon. You got to remember, this is my next life. This is the next chapter of my life. So I'm doing it a little slow, but I am CE certified now. So I'm doing some big stuff again.
I love it.
And but it's all been word of mouth up to this point, and it's been a lot of fun.
But until then, they can still go to your YouTube channel and watch your shorts.
Or shoot me a message.
Shoot her a message. Yeah. See if she has time for you. I'm gonna come and get trained by you. I need you to train me, and also to kind of fix maybe some of the bad habits I've gotten into.
Oh, I'd be more than happy to. I love it. I see people holding the ultrasound and they do this, and I'm like, what is that?
That's what I
hold it like a pencil. Hold it like a pencil. Get your hand close to the face. Get those fingers close to the patient's face. All the things.
Can you before we wrap it up, talk a bit about sterility? That's a fear that I think some providers have. You can have the sterile condoms put on there, right?
Yeah. So
and the gel.
I'm not sure how much I want to really pick this battle. I really want providers. No, I'll talk about it. Yeah. I really want providers to use ultrasound more. Mm-hmm. And when it comes to ultrasound guidance and needle sterility, cleanliness, that transducer should be covered if you are scanning over the area where a needle is penetrating the tissue. So there should be a condom applied. And that is, a standard in the hospital. In the outpatient center, maybe not quite as much, but you really want to be careful if you're going over an area where you're poking with a needle, then there's potential for allowing bacteria to enter. So we want to keep patients clean and safe so they don't have that risk for biofilms down the road, abscesses and things like that. Yes. But by the way, if you do get those, you can scan them.
You can.
Yes, to identify what we have going on. There are other clinical symptoms aside from, being able to identify under ultrasound. There are other clinical symptoms that you look out for some of those things. But bottom line is it's a wonderful tool. Though. Yes, it does. It's a great tool for all the things.
Yes. So ultrasound, you need to be sterile, especially when you're doing injections or you've made an injection in the face and you go back over it. Just make sure you get the sterile gel and you get the sterile condom. They're not that expensive. Mm-hmm. You can order them from wherever you order your medical supplies from.
Right.
But I have seen a little bit of that on videos, and it kind of frightens me a bit. So I wanted to bring that up before we wrap it up.
But I'm so proud of them for getting that ultrasound out. Yes. But that is the next step.
Let's the next step.
Go back to, the basics of medicine and keep the patient clean so they can have a good long-term outcome too. Because we don't always see the symptoms of that unsterile environment, right? Or the unclean environment right away, because biofilms can become an issue as the product starts to degrade 3 to 5 months later.
Yep.
Yeah. Mm-hmm.
Okay, Janell. Well, I just love having you on.
Well, I love being here. So thank you for having me.
And I really encourage you, I know I said at the beginning, I encourage you guys to go back and watch the first podcast that Janell did with me called, we entitled it Aesthetic Entrepreneur, because she is. She built her practice. She explains it. She explains her awesome history, why she became a nurse, her wonderful family. You get to learn everything about Janell.
Thanks.
And so I encourage you to go back and watch that and then use her as a resource. Like she said, you can DM her.
Yeah.
You can reach out
Message
to her,
me.
message her. And if you can't get a hold of her, don't call me saying you can't get a hold. No, just kidding.
I reply to messages.
She replies to messages.
I
She
do.
does.
Yeah.
Thanks, Janell.
Thank you for having me. It's
And
been such a
we'll
privilege,
see you again.
Jerry. Okay. Look forward to it.
You're our go-to girl.
I'm here for you.
All right.
Thanks.
All right. Thank you, everyone, for being here today. And we always wrap it up with our toast. So this is just kind of our beauty outlaw thing we do.
Thank you.
Janell's a regular, so not regular.
A
with
regular
alcohol.
with, no, that's exactly the way I took it. I'm like, how does she know me so well?
Cheers, everybody. Check us out in 2 weeks. We'll have another podcast, but check hers out prior and follow Janell on YouTube. She's easy to find and she's an amazing resource for everyone. And I'm glad I get to call her my friend.
Thank you. Thank you, friend.
Cheers.
Cheers.
Peace out.